Oh, we're going on.
Okay.
Mhm. All right. Hope you've had a cup of tea, everyone. We're on to our next talk this afternoon. And I'd like to thank Lake Imaging for sponsoring the session. And I remind you to go into the sponsor area. You'll get points and you're more likely to win a prize. So go ahead and have a look after we're done. So enough today. Oh, actually, it's AstraZeneca, I'm sorry, today. So that's the one to have a look at. So would I be able to just have, and also a reminder that everything here is on health pathways, and remember to use them. Very useful resource. Can I please have Tetyana's profile up, please? Yes. So today we're lucky enough to have Dr. Tetyana Rocks, who's quite well known, and she is a postdoctoral research fellow and head of translational and education stream at Food and Mood Centre, Deakin University. And her main role within the centre is to support the translation of the current evidence in the field of nutritional psychiatry into policy and clinical practice. As part of her role, she collaborates with a number of international and national organisations to synthesise and create and disseminate evidence on diet and mental and brain health, and is regularly invited to speak at academic and professional community events. Dr. Rotz is also co-running a highly innovative studies examining the role of gut microbiota in eating disorders and obesity. Dr. Rotz is an accredited practicing dietitian and has extensive experience in tertiary and professional education, including hands-on and online courses in diet and mental health. So we really look forward to hearing from Tetyana. Thank you.
Excellent. Thank you for a wonderful introduction, and good afternoon, everyone. Thank you for having me here today. First, I would like to acknowledge the traditional owners of the land from which I am meeting you today, and for me, it's Wadawurrung people. I'm here to discuss with you nutritional psychiatry, that area of research and practice that focuses on diet as a way for preventing and treating mental health disorders. I'd like to acknowledge all the organizations and support group who's helping me in my work. So I'm coming to you from the Food and Mood Center. We're part of the Impact Institute, School of Medicine, Deakin University. Our center is only about 5 years old, but in these years we covered a fair bit of ground and grew substantially from a couple of researchers to a multidisciplinary team of over 30 researchers and practitioners. Our team is working on the development of new nutrition-focused preventative strategies and treatments for mental and brain disorders. We're building evidence on the links between food and mental health by both assessing current research and developing new studies. We have a fairly broad take on diet and mental health, looking at the relationship from nutrition and neurodevelopment at earlier life, aging by linking diet to cognitive decline and neurodegeneration. Along with mental health, we consider physical health, of course, particularly physical activity and gut health, and develop research in gut microbiota and other mechanistic pathways linking diet and mental health. Our center is unique in nutritional psychiatry focus, and we support that critical importance of diet and psychiatry. Particularly when we take into account that today pharmacological approaches have achieved a very moderate reduction in the worldwide burden of poor mental health. And there's clear indications suggesting that the disease or burden of disease attributable to mental health will continue to rise. Because of this urgent need for additional methods for prevention and treatment, diet, along with exercise and other lifestyle factors, is a central determinant of all aspects of health. be it physical or mental, and we need to recognize this. That's coming to us through the concept of nutritional psychiatry, which was established in 2015 by a group of researchers and practitioners led by Professor Felice Giacca, who is the director of our center. The group continued to form the International Society of Nutritional Psychiatry Research, and membership to that society is currently open. It's important methodological quality of research exploring those relationships between diet and mental health. Of course, etiology of mental health disorders is highly complex, and there's many determinants such as genetic or biological factors that are challenging to target in treatment. But factors such as lifestyle in general and diet in particular are modifiable. This could be improved most of the time, and they should be considered. There's a large pool of strong observational data on the topic showing that diet and mental health are linked across the life course. One of the first studies on the topic were conducted 10 years ago by Professor Felice Giacca, and it was one of the first evidence showing the relationship between habitual diet and mental health disorders. It was done in a sample of women conducted in our current local areas, our Geelong osteoporosis study, of course. That study went on to be published in the American Journal of Psychiatry, went on a cover of the journal, and was a really breakthrough, really seminal study on the area. After that, tens of studies coming from all over the world were showing pretty much the same associations between diet and mental health. They show that relationship kind of U-shape and or bidirectional relationship, between high intakes of unhealthy food and low intakes of healthy food, all independently associated with depressive, particularly common mental health disorders such as depressive and anxiety disorders. We see the difference, studies showing us that pregnant mothers, the better diet quality is, the better behavioral outcomes of children are. And we don't do this study, of course, to put a pressure on pregnant mothers. They have enough pressure, but just to raise awareness how important diet is even before we're born. We see independent relationship between diet and mental health, such as depressive symptoms and quality of life in older children, in teenagers. And what's important, these relationships are largely independent of other factors which often impact our mental health, such as education, body weight, different health behaviors. We see that in adults, consuming higher quality of diet decreases risk of developing common mental health disorders such as depression by about 30%. This particular study I'm showing you looked at a range of different dietary styles and came up with two winners. So Mediterranean diet or Mediterranean style diet and lower dietary inflammatory index diets. And if you know anything about diet, you kind of know that no matter how you call better or healthier diet, it's a diet with common denominators such as high intake of grains, high intake of vegetables, high intakes of fruit, and low intake of highly processed or ultra processed foods. And as I mentioned, quite often this relationship exist independently of other factors which might contribute to our mental health. And no matter how you call cuisine, it could be Mediterranean, Scandinavian, Japanese traditional diets. We have studies from all over the world showing that no matter how you call it, traditional or whole food diets are so much better for both preventing and treating mental health than so-called Western style diets, which usually very high on consumption of ultra-processed foods, which it's with high added sugars, salts, and saturated fats. There's a number of closely linked biological pathways which show us why and how diet actually impacts our mental and brain health. These include inflammation, oxidative stress, epigenetics, mitochondrial dysfunctions, gut microbiota, neurogenesis, and others. I'm flagging this paper published by the team a couple months ago, and it's quite an accessible yet thorough review of all biological mechanisms that link diet, mental, and physical health. It's a great read. If you think of something to do tonight, think about reading this paper. Although today the great majority, I have to say, the great majority of research that attempts to explain the mechanisms behind diet and mental health is actually coming from preclinical space. I really would not be a dietitian if I didn't believe that each and every of these mechanisms could be optimized by diet. Also, when we unpack mechanisms involved in the relationship between diet and mental health, this unpacking could explain this high comorbidity we see in mental and physical health, particularly metabolic health. We know that individuals with ill mental health are much more likely to have another chronic condition, at least one, but often a few. We know that life expectancy of people with poor mental health on average 20 years shorter than of those without mental illness. Rates of diabetes 3 times higher, rates of cardiovascular disease, it's almost 4 times higher than of that in general population. Of course, US GPs be on the front line of this treatment and see that comorbidity, that comorbid presentation quite often. And the poor physical health of many people living with mental illness is due, at least in part, to the side effects of medication, range of socioeconomic factors, and inadequate support, let's face it, inadequate support by the system. At the same time, many people living with serious mental illness, for many of these people, improving lifestyle factors, including diet, is possible. I'll go on into showing few studies which showing us exactly that, reporting exactly that. We can change diet, particularly for anyone, basically, for anyone who's willing and who's motivated enough. And what we think in our center and what we stand for is that holistic care that addresses the psychiatric symptomology but also incorporates lifestyle factors. It's not just an option for people with severe mental illness, it's an absolute necessity. Particularly when we know that pharmacological and psychological approaches are often quite insufficient to address the burden of the overall mental health disorders and physical comorbidities. We know that adjunctive dietary treatment improves mental health symptomology, but it also supports physical health, and it's happened to be highly cost effective. Well-developed dietary intervention also build that skill, they build self-capacity to support long-term behavioral change and support that sustainability in healthier lifestyle. I'll go into a couple studies just to show how dietary approach could be used in treatment of mental health disorders. Our group was the first in the world to conduct a randomized controlled trial that showed that dietary intervention could be successful in treatment. This was the SMILES trial, and it was absolutely fundamental to give rise in many activities conducted by our center. That study was run in 2017. We used individuals with clinical depression, so with major depression. So not just self-assessment, but actually medically diagnosed individual with depression. We enrolled 67 adults. It wasn't easy because doing dietary trials is notoriously challenging. We managed to enroll 67 individuals, and we provided them with 2 different treatments. One group went into dietary support, another group went into social support. They followed befriending protocol. Both groups had a similar meeting schedule to mimic intensity or to match intensity. Our dietary intervention was based on Mediterranean diet. We called that ModiMed diet or modified Mediterranean diet. It was designed, and delivered by a dietitian, wonderful Dr. Rochelle OP. She designed the diet, and as I mentioned before, based on Mediterranean diet, but of course adjusted for Australian conditions. So one of the main adjustments were higher intake of red meat, high intake that it's usually noted in Mediterranean diet. So the dietary intervention also included individual support, and it was pretty basic, pretty simple. It was consistent messages about changing the diet for the better. Overall, participants had 7 sessions with dietitians. By the way, all of this information is available on our website if you'd like to know more about how it was done. But basically, it was simple sessions. Dietitians know how to do that. So couple first sessions, of course, focused on establishing rapport, understanding the level of skill, understanding barriers, understanding knowledge, understanding level of motivation. Then each session was built around forming some kind of goals, usually no more than 2, and reviewing previous couple weeks how participants were going. As I mentioned, if you want any more details about each session and how they were run, please go and find the study online. It's all available through free access. Here, just this slide, just an example of diagrams kind of we used in the study. And as you can see, it's quite closely following Mediterranean kind of type of diet. It's the largest amount of energy was coming from whole grains, following by fruit and vegetables. We also focus on intake of dairy. We use low-fat dairy in our study, olive oil, nuts, legumes, lean red meat, fish, eggs. And what's very important that we also ask our participants to limit intake of all the extras or ultra-processed foods down to about 3 serves per week. Again, if you look at diagram, please remember it's a general recommendations. Of course, they were adjusted for the needs of each and every individual. So if it's a slight build female of middle age, we probably wouldn't recommend 8 serves of whole grain. So this needs to be adjusted, these recommendations to the needs of each and every individual person. This slide is an example of resources we used in the study to make the information easier to deliver and process for the participants. As you can see, the aim was to make changes easy to take up, easy to maintain, easy to sustain. So simple meal suggestions, nothing particularly intensive, nothing particularly expensive or not readily available in most supermarkets. Of course, study was run in the metropolitan Melbourne and Geelong areas, so usually you expect this kind of repertoire of foods in pretty much every supermarket in every corner store. Because we know that, of course, people with mental health disorders have a limited motivation and limited desire to prepare meals. You don't batch cook when you're depressed. So that's why we used very simple ideas for mixing food together and preparing that simple and healthy meal. So the SMILES outcomes showed that this direct relationship between changing diet for the better and changing depressive symptomology for the better. in this trial, we not only seen a great improvement in diet quality of our participants, particularly impressive was reduction of consumption of extra foods, so those ultra-processed foods. We also saw increased consumption of vegetables, fruit, grains, and these dietary changes led to significant improvements in depressive symptomology as well. So much so that 32% of dietary support group actually achieved remission by the end of 12-week participation. We also conducted economic evaluation because we kind of if you look at the media, if you go to supermarket, you have impression that the healthier diet is costing more. It's not the case, of course. It's all marketing. We actually done costing. We costed 7-day food diaries of 20 participants, and we estimated that before going into our trial, they spent on average about $138 per week. Again, remember Metropolitan Melbourne and Geelong couple years ago, and following recommended diet was estimated to cost about $112 per week. So eating better doesn't cost more, but it does require knowledge, skills, and preparations, of course. We also did economic evaluation of the SMILES trial and showed that on average, the economic evaluation showed that on average, compared to social support for dietary support, health sector costs were $850 lower, and societal costs were almost $2,500 lower. So dietary support compared to social support. And differences were driven by lower cost due to fewer appointments with healthcare professionals and also lower cost of unpaid productivity. There were much more trials done since the SMILES trial, which I don't have time to go into today, but this growing evidence led to meta-analytical level data showing to us that dietary intervention significantly reduced depressive symptoms. So common mental health disorders, depressive and anxiety symptoms, depressive symptoms definitely can be increased by eating better. We see mixed findings for anxiety, and it's due to several reasons. We also see that generally interventions work better in females than in males. It's usual cause for dietary interventions. And of course, evidence are clear that interventions which are designed and driven by dietitians usually have a greater impact as well. So this growing understanding and this growing evidence acknowledging the very recent clinical practice guidelines for mood disorders from the Royal College of Psychiatrists. In these guidelines, particularly for major depression, diet is placed on the first line of action together with other lifestyle practices such as exercise and sleep. So when it's come to diet, it's a first step to sort out in management of depression. And the recommendations for healthy mental health diet are not tricky. They're pretty easy. We all kind of know what to do. It's more about flexibility, sustainable approach to diet. The main challenges are, of course, in implementing such a dietary approach in the difficult circumstances, which often we see surround people with major depression and other mental health issues. Best thing is to do if you'd like to treat like to treat depression with diet in your patients, it's probably refer them to dietitians. So in Australia, accredited dietitians or accredited practicing dietitians are those health professionals who are trained to deal with diet. They not just know that cucumbers and carrots are good for you, they also have a range of knowledge which is quite useful when we're trying to change dietary behaviors. I just also thought I'll show you a couple examples of how diet could be used in individuals with severe or serious mental illness as well. This great study, again, Australian example, it was based on Healthy Med study, which I didn't go into today, but it's a group kind of approach, group dietary intervention for individuals with depression, but it was used in the rehab center for people with severe mental illness. And it showed that 3 months of running educational sessions for staff, mind you, for staff, and for the residents, which were based on quite interactive suggestions, interactive classes, interactive lectures, cooking workshops, food hampers, guided shopping tours, that led to quite a strong evidence of improvements, not just in knowledge, but also in dietary changes. So it was clear reduction in poor nutritional habits and also development of independent living skills. That's what I was talking about. So we need to, it's not hard to do when you have knowledge and skills, of course. And we see that dietary interventions do work at the range of settings and at the range of mental health issues. We have another fantastic group in Australia called Keeping Body in Mind. Of course, again, just plug in for you that this information is available, it's accessible. It's come with great information, great supportive documentation too for you to have a look and to use in your practice if you so wish. Another fantastic group is coming from my heart, Sunshine Coast. That's where I'm from originally. And there's a group of practitioners working in a rehab center, developed say a self-capacity model. It's again intervention model which use integrative approach in treatment of mental health disorders. So it's use drug and alcohol cessation, diet and nutrition optimization, physical activity regulation, and smoking cessation as big four, and then other supportive treatment approaches to help at that more holistic treatment of serious mental illness. In this facility, majority of patients either with schizophrenia or other psychotic disorders. I just thought I'd show you a few photos how it's actually look in practice. That's from us visiting the center and helping them to develop the model. So those little kind of activities, motivational slogans are all over the center. Everyone is together in this, all center working at the same with the same goal in mind to improve their outcomes. They grow in vegetables, they have little gardening tips, they have tours around the garden, they have people who in charge of gardening for certain weeks, in charge of food preparation, and in charge of explaining and passing on knowledge to other residents. It's a fantastic facility where everyone cooks and pretty much eats together. They also do shops together, practitioners and patients. So they also do exercise together, play together, and that's one of the examples of their lunches. So I'm not saying that they have lunches like this every day, but they actually do cook together to build the skill around food and diet. We published just recently, a couple months ago, explanation of this model. So if you're interested, Australasian Psychiatry have this publication. Look, if everything was so easy, of course, we all would be eating perfectly and everything would be fine, and I wouldn't be talking here to you and I wouldn't be working and doing what I'm doing. But we know that, of course, there's a lot of issues and barriers. We know that there's people quite often fatigue. There's a lot of behavioral, there's a lot of motivational issues, there's comorbid physical conditions, which we discussed before, there's disordered eating patterns. So it's pretty hard to know where to start and to be able to deal with implementing dietary interventions or dietary changes. There's quite a few skills for practitioners as well to obtain. understanding how psychoeducation work, counseling and behavior change techniques, of course, nutritional counseling, which have to be empathetic and non-judgmental, understanding cultural implications of nutritional counseling and why people eat. And generally what we see from literature, of course, that collaborative multidisciplinary approach, is the best way to treat mental health disorders with diet. To implement this in your practice, we need to have both practitioners and patients willing, able, and ready. If you don't use that in your practice and would like to start somewhere and you don't quite know where to start, there's few simple questions for you to maybe try and talk to your patients about diet. So you don't have to have specific tools for dietary assessment, just asking people how, say, for example, healthy food might look to them would give you a lot of ideas where people at and how prepared they are to actually talk about diet and start implementing some dietary changes, because we understand that if people in pre-contemplation mode, if they're not ready for changes, we're probably wasting our time providing them with dietary tool. We probably best just to continue conversation, to assess the readiness for change, and then start acting when people actually ready. It's quite important to understand what barriers each and every individual have, so we can adjust our treatment based on these specific barriers. It's also good to understand that we need to start somewhere. If we start somewhere, best to start with SMART goals. So simple changes, maybe trying an apple a day or decreasing consumption of soft drinks from 3 liters a day to 2.5 liters a day, and see how we go at that. Also, realistic expectations. That's why I use in the example of 3 liters of soft drink, because everyone is different, and for some people, changing diet but for the better might mean consuming some kind of food regularly. Doesn't matter how healthy it is, at least it's a regular consumption of some kind of food could be a dietary win. So that's why it's good to understand where our patients are actually coming from. Here I thought I'll give you a couple examples of quite accessible resources if you're looking for more information about food, which you perhaps would like to recommend to your patients. Head to Health have very simple, very accessible resources around food. We also have Food and Mood Center website, which provides quite a few blogs, quite a few recipes, different information around food, more specifically around food and mental health. We also running free online course. It's quite consumer focused, so I share the course on FutureLearn. It's completely free. It's 3 weeks. We have over 65,000 enrollees from all over the globe, and we usually have a lot of fun there unpacking mental health, unpacking diet, and understanding the links between diet and mental health. I'm also developing a range of postgraduate level courses. So we have endorsement from the Royal Australian New Zealand College of Psychiatry to develop CPD activities. And I'm also hoping to get the same endorsement from other professional colleges. So if you'd like to improve your knowledge on diet, improve your knowledge on changes in dietary behavior, please follow up either our center website, shoot me an email, or follow me on Twitter for the updates. One thing I'd like to kind of always finish up with to remind us all that it doesn't have to be perfect to be good. The road, our life is very long, it's very complicated. Dietary pathways are very long and very complicated. When our dietary environment looks like this, it's very challenging to make changes to remain within a healthy kind of dietary space when all what you see driving around is this. But another thing is great to remember that for individuals with mental illness, recovery is foremost that feeling of hope, healing, empowerment, and connection. And this could be achieved with and without dietary changes. So I just thought it's good to remember this. Thank you so much to my Food and Mood Center team who supports me in everything I do. And thank you very much for your attention today and opportunity to present to you.
Thank you so much, Tetyana. That was so interesting, and I think such a good reminder to all of us, not to underestimate diet. I mean, for all of us, but particularly our patients who have mental illness, because I think, sometimes we do get overwhelmed, but it's a really good thing to focus on. And I think you've given us some good strategies to start that conversation. And the other thing that I was thinking is, a referral to a dietitian for these people would be a really helpful thing to do. So thank you.
Absolutely. But that's before referral, that's what I thought, just asking about diet and figuring out where people might be. They might have, zero interest or understanding or care for diet. So referral to dietitian would probably never gonna be used, So it's good for
Yes.
GPs. And of course we know GPs, 60% of patients are coming in with mental health related issues. So understanding where people at and then triaging them, making
Yep.
referrals accordingly, that's would be great.
Probably the best question to start with is, asking them what they think about their diet, rather than just prescribe a diet, is
Oh,
what do they think about their
absolutely.
diet?
Yeah,
Mm.
absolutely. 100%. Just starting conversation about diet. And if we're not trained, and we know that generally medical professionals in Australia, unless you're dietitian, you're not trained in this. So where do you start? So just simple, like how would you describe your food habits, or what do you usually eat? Do you
Mm.
do you care for what you eat? Do you just eat? Do you shop because that's you have $10 and you want to buy something to eat, or you would like to use your diet somehow differently?
That's really fantastic. So we've got some questions here, which I
Great.
will read out. So Anonymous asks, what was the paper you suggested reading tonight? Apologies, I missed that.
So that's the mechanisms. It's by Marx et al. And it's on mechanisms linking diet and mental health. This one,
Me-
biological mechanisms.
Yeah.
That's the
me-
one.
Yes, biological mechanisms. Yeah,
Yep.
excellent. Jill Ramsey asks, fantastic. Why can't I find dietitians like you?
I know. Look, all dietitians, when we graduate, we all have a basic understanding around diet and impacts of diet on mental health. So dietitians are out there, they are available. So good luck finding the best ones you can work with. Look, it's like anywhere basically. I think we need to try quite a few people before we find the one we like.
That fits.
Mm.
Anonymous asks, where can people go in Geelong for a group cooking therapy? Which I think that's a great question, because it's also the social connection
Oh,
that's associated with that, isn't it?
yeah, absolutely. Unfortunately, I don't have an answer to this. I can follow up on this if you like to email me on Tetyana rocks at deakin.edu.au. I'll find the answer for you. But I know that last year was, of course, heavily destructive in this, so I don't have something on top of my head.
Yeah.
But that would be fantastic. I do recommend people, if when I present to consumers or to communities, I recommend people starting cooking, shopping and cooking groups. So on Saturday, you can go get together, go shopping, put, I don't know, $20, $30 in, and we know $20, $30 multiplied by 10, we're all gonna come out with quite a few serves of soup to freeze for the later. So maybe we can recommend that to patients as well.
Mm, mm. Jane Opie
Mhm.
asks, this will be controversial. The carb content of the recommended diet is high.
Yep.
Thoughts?
Absolutely, look, and that's why I mentioned it depends on individual. Of course, we know that when people have type 2 diabetes, which quite often come as comorbid presentation, particularly in severe mental illness, we need to look carefully and adjust the servings of carbohydrates accordingly. But we need to remember that actually servings of carbohydrates, when I talk about carbohydrates, I talk about whole grain foods, I talk about root vegetables. So when you think about the serve of carbohydrates, it's not actually that big. It's a small kind of slice of toast. So that's one serve. So if we're talking about, say, 45-year-old male who presents in a, say, BMI of 30, I think that, up to 8 serves of carbohydrates, high quality carbohydrates, is quite realistic. But of course, adjustment will need to be made based on individual presentation.
Anonymous asks, I have a patient with autism spectrum disorder and only eats white food. I've got one of these too, Anonymous.
Yep.
I have him consuming super green tablets, and this has helped him. Do you find this?
Look, generally, I have to say I'm not practicing as dietitian much. I'm more research dietitian. So it depends. Of course, our first line of recommendation is always food, because what we see, optimization, dietary optimization, which could be done through food, is often unachievable with supplements. But when we have such a highly restrictive eaters, anything that might help them is a good thing. So you just have to be careful of what you actually recommending and what you trying to introduce, particularly if you trying to make sure that appetite doesn't decrease. What we quite often find with supplements, depending on the supplement, they could impact appetite quite substantially. So for people who already very restrictive in their dietary intake, recommending supplements and consuming supplements would actually be quite counterproductive. But if it's a last resort and it's working, yeah, go. What can I say?
Arthur has asked, are we able to download the slides from the weekend's presentation? Yes, and I agree. So Tetyana's presentation was fabulous, and we will email you the all the presentations after the conference next week.
Mhm.
So don't stress anyone. Paul Egan asks, junk food gives a dopamine hit. How does a good diet work by biochemical effect?
Look, that's that's a great question. We do know that's why we like junk food, because it's tasty, it's palatable, it's full of fat, it's full of sugar. So healthy diets such as Mediterranean diet, why we think it works well and why it's quite sustainable, it's very low on restrictions. So basically, on Mediterranean diet, generally we tell people to eat whatever they like, as many fruit and vegetables as they like, as much nuts, honey, dairy as they like. So this kind of lack of restriction could be kind of balancing act when we're trying to go against junk food, and just explaining to people, maybe talking and kind of more building the knowledge about what's happening and how it's work in kids actually and in teenagers. What is interesting, there's some fabulous studies which been done exactly on that. They showing teenagers how junk food is actually affecting their brain, and it's also going into a bit into social justice for teenagers. Teenagers are quite proactive in their social justice arena, so showing to them what junk food actually doing for population, how it's targeting minorities, how it's targeting junk food advertisement, how it's targeting younger kids, how it's targeting people from low socioeconomic background. It actually works for teenagers. We see even talks like this to teenagers then impacts their dietary choices for the week to come, which is quite an interesting studies now done at school. So yeah, I agree with you. Junk food is tasty. That's why we all like it. And it's everywhere.
And it's easy.
Mm.
So people, yeah. But I like that social justice message because it's finding out what's meaningful to people.
Absolutely. Absolutely. That's why, that's why I'm talking about, having just conversation, initiating discussion around diet, if you have time for it, of course, during your consultation.
Okay, Laurie Cameron asks, can you tell us about specific nutrients that work in depression? For example, fish oil, magnesium, B6.
I did not prepare a presentation around nutraceuticals, but we do know that there's quite a strong evidence, particularly around fish oil. You answering your own question. So there are recommendations for fish oil, particularly in mild depression as well. So supplements, it depends on also on the quality of supplements. So there's few few factors we need to keep in mind. It needs to be high quality supplement. The doses also needs to be quite carefully targeted. We have published recommendations on this, and I don't remember the name of them straight away. If you like to email to me, I'll send you resources on this, but there's definitely resources on supplementations, particularly fish oil is a strong one.
Okay. And we'll let people know your email so that they can get in touch. Anonymous asks, perhaps updates on the food and mood resources could be sent to Help Pathways. And yes, we will follow that up, Anonymous. And Anonymous asks asks about whether the presentations will be able to be seen, and they will be emailed next week. So you will be able to access the recordings. And I think that's the end of our questions, which is actually good timing because we've just got 3 minutes left. So
excellent timing.
I want to thank Tetyana for that. It really was a very inspiring talk, and it's made me think about thinking of diet. And I want to remind everyone to fill their evaluation out at the end of this, please. And remember, each time you join a session, you're more likely to win the prize. And also, if you go to the sponsor rooms, I think there's some more prizes as well. And Tetyana's put a lovely slide there. It doesn't have to be perfect, and I think that's something that we work with all the time. And be positive. I think we've got some lovely messages there. Let's be positive. For individuals experiencing mental illness, recovery is small for me, but hope, healing, empowerment, and connection. Yeah. A feeling of hope, healing, empowerment, and connection. Thank you so much, Tetyana. You've been muted. We didn't hear you last. Yes. All right. Thanks, everyone. We meet again. So we'll close up and we'll see you in the next session. Thank you.